Welcome to Test Taking Strategies with Everyday Nursing LLC with Dr. M. DNP. We'll go ahead and get started. So remember, as we continue this test taking strategy series, our main focus and our main goal is to remember what? We have to hit that bullseye. And the main objective of your nursing exams, and of course, ultimately NCLEX, will be to make you a very safe nurse. That is the purpose of the NCLEX-RN, NCLEX-PN examination, is to determine whether you are safe to practice. So let's start with the test taking strategy and look at some of the questions and put what we have been learning to use. After placing a stethoscope as seen in the picture, the nurse auscultates S1 and S2 heart sounds to determine if an S3 heart sound is present. What action should the nurse take first? Is it A, slide the stethoscope across the sternum, move the stethoscope to the mitral site, C, listen with the bell at the same location, or D, observe the cardiac telemetry monitor? So looking here, our keyword here is first. Our keyword here is first. So after placing a stethoscope as seen in the picture, the nurse auscultates S1 and S2 heart sounds to determine if an S3 heart sound is present. What action should the nurse take first? Right? The best thing to remember, the nurse uses the bell of the stethoscope to hear low-pitched sounds, such as S3 and S4. So when you're listening at the same site, you want to use the diaphragm and bell before moving systematically to the next sites. And always remember your aortic, pulmonic, tricuspid, Erb's point, and of course your mitral, which is the fifth intercostal space midclavicular line, which is your point of maximum impulse. So always make sure you're really familiar with how to use your assessment and of course your equipment. And when will we possibly hear an S3? Know your normals and your abnormals. So S3, we see a lot in patients who are retaining fluid, especially patients who have congestive heart failure. Next question. The nurse is assisting the mother of a child with phenylketonuria, PKU, to select foods that are in keeping with the child's dietary restrictions. Which foods are contraindicated for this child? Is it A, wheat products, B, foods sweetened with aspartame, C, high-fat foods, or D, high-calorie foods? So again, we're looking for something that is an issue, right, for the child with PKU. Pay attention to the key word, dietary restrictions. So contraindicated, meaning the rest the child can have, and I'm looking for something that the child cannot have. So it means I need to have a good understanding. So key words here, aspartame should not be consumed by a child with PKU because it is converted to phenylalanine in the body. Additionally, milk and milk products are contraindicated for children with PKU. So another test taking strategy, and it's always an issue for nursing students. You always want to make sure that you add this to your laundry list. Lab values. So common NCLEX course exams, ATIs, HESIs, etc. You want to make sure that you have memorized and you have committed to memory your lab values, which include ABGs, BUN, creatinine, total cholesterol, creatinine, glucose, your hemoglobin A1C, hematocrit, hemoglobin, INR, platelets, your potassium, fluid, electrolytes, PT, PTT, APTT, sodium, and your WBC. You have to make sure you know what's on a basic metabolic panel, what's in a CBC. Do you know what a CBC, what differential is? What do they mean? Okay. So the biggest thing too, you want to make sure, just like you know your date of birth, just like you know your social security, especially for those that are going to get a refund check, right? We want to make sure we get that check paid in full and returned on time when we pay our taxes. You want to make sure that you know your lab values. Hence, on Next Generation, you will be given your lab values, and it's great, but it's just remember a reference. So you need to recognize normal and abnormal values. And the biggest thing is to know the trends. What does it mean when a patient has a hemoglobin of 6? What does it mean when my platelets are 50? What does it mean when my potassium is 7.9? Okay, that's what we're paying attention to. Our job as nurses, right, is to recognize critical lab values and to know what to do. So you really want to make sure you put that on your laundry list of things to really memorize and have a thorough understanding of. In addition to that, pharmacology, making sure you know your drug endings, your antihypertensives like your beta blockers that decrease blood pressure and heart rate. Remember, those end in LOL. Your calcium channel blockers, antihypertensive, decrease blood pressure and heart rate. Those usually end in depine. And there's two classes of calcium channel blockers. Your cardiac glycoside, like DIG, very heavily tested on exams, and of course, NCLEX. They decrease heart rate, so I need to always have a baseline heart rate. I hold digoxin for a heart rate less than 60. It also has a lab value you need to know for DIG, therapeutic lab value, 0.5 to 2. When anytime a patient has a greater than 2, I want to hold that DIG or they will become toxic. Know the signs and symptoms of DIG toxicity. Know your antidepressants, your SSRIs. Know your PAMs, your anti-anxieties. Know all your anti-anginals, okay, especially for your MI, your heart attack. So your nitrates, your nitro. Know all of your insulin, okay, rapid, short acting, intermediate, and long. Know all of your oral anti-diabetics, especially your metformin, okay, your bianguanide, your sulfonylureas, your antibiotics, your cephalosporins, your xylins, fluoroquinolones, aminoglycosides. Know all of your analgesics, your pain meds, your narcotics, your opioids, okay, like your morphine, your NSAIDs, ibuprofen. Know your antidote to your opioids, like your naloxone. So you really have to have a good understanding and make a list of all your antidotes, your therapeutic drug values, your diuretics, okay? Know all of them, not just your favorite loop diuretic, which is furosemide. Know your thiazide, your loop diuretics, your asthmatic diuretics, your potassium sparing diuretics. Know your bronchodilators, especially your short acting, like albuterol. Know your corticosteroids, those that end in ONE or LONE, okay? Make sure you know your anti-neoplastics. So these are always going to be important. Make sure you know your anticoagulants, your warfarin, heparin, okay? Your agatroban, your clopidogrel, Plavix, Xarelto. Know your antiplatelet like your aspirin, your anaphylaxis, key medication, your epinephrine, your antidysrhythmics like amiodarone, your thyroid medications like levothyroxine, stool softeners like doxate sodium, and your statins, anti-cholesterol. So again, make sure you go through these classes. Make sure you know what the therapeutic values are. In addition, for your medications, many students don't know what they need to know for meds. That's why, as my particular student, you need to know your indications, your classifications. They're very, very important. At the very least, know what the medication is for. This can always help you answer the question, the classification, the generic names. What is the medication for? What system does it affect? Cardiac, respiratory, renal, GI. Know the nursing considerations before, during, and after you give the med. So these are the things like knowing what vital signs to take, what lab values to look at. So, of course, for digoxin, we look at heart rate. For furosemide, we look at potassium. If there are any contraindications, and monitoring for side effects. The side effects, remember, Don't memorize a list of side effects. 80% of medications cause GI upset, nausea, vomiting, diarrhea. Remember the nursing considerations along with the effect. So, an example is knowing that a beta blocker has the side effect of low blood pressure and low heart rate. Therefore, your nursing consideration is to check the blood pressure and heart rate before you give it. If the blood pressure is below 105/60 or the heart rate is less than 60, you wouldn't give it. Those are the important things. So even the adverse effects, the key adverse effect for ACE inhibitors is what? Angioedema. Remember, side effects never killed anybody. It's the adverse effects. So if you see medications that cause angioedema, Steven Johnson, issues with white blood cells, those are things you really want to pay attention to and take note of. So remember, go through everything that we've gone through. So the types of questions you need to make sure you're familiar with. Priority questions. Who do I see first? What clients to see first? What can I delegate? Make sure you know how to answer the teaching and learning questions. Your select all that apply. Repeat your skills. Make sure you know your procedures. These are all important when it comes to test taking strategies. When you know what to expect, you'll do a lot better. So let's do another question. The nurse notes that a client has been receiving hydromorphone dilaudid every 6 hours for 4 days. What assessment is most important for the nurse to complete? Is it A, auscultate the client's bowel sounds, B, observe for edema around the ankles, C, measure the client's capillary glucose level every 4 hours, or D, count the apical and radial pulses simultaneously? So my key medication here is my Dalilali, right? My Dilaudid, which is an opioid. Of course, hydromorphone is a potent opioid analgesic that slows peristalsis and frequently causes constipation. So it is most important to auscultate the client's bowel sounds before you give the medication. Next question. A female client is admitted with end-stage renal. A female client is admitted with end-stage pulmonary disease. The patient is alert, oriented, and complaining of shortness of breath. The client tells the nurse that she wants no heroic measures taken if she stops breathing, and she asks the nurse to document this in her medical record. What action should the nurse implement? Is it A, ask the client to discuss do not resuscitate with her provider? B, assist the client with advanced directive paperwork? C, assist the client, ask the client if they would like to discuss with family members first? D, inform the client that these decisions are permanent. So again, looking at what's going on with this patient, she's saying she doesn't want any heroic efforts. And it tells you she has end-stage pulmonary disease. She's alert, awake, oriented, and she's complaining of shortness of breath. She doesn't want to be saved, is essentially what she's saying. So the key part here is ask the client to discuss DNRs with her healthcare provider. That's very, very important to understand the wishes and respect the wishes of your client. But the legalities are she cannot legally be a DNR. So it's signed by 2 physicians. So you really want to make sure the healthcare provider discusses that with her. And once she agrees, and if it's done, that needs to be placed in the chart. Until then, she is a full code. The client is receiving a full-strength continuous enteral tube feeding at 50 mLs per hour and has developed diarrhea. The client has a new prescription to change the feeding to half strength. What intervention should the nurse implement? A, add equal amounts of water and feeding to a feeding bag and infuse at 50 mLs per hour. B, continue the full strength feeding after decreasing the rate of infusion to 25 mLs per hour. C, maintain the present feeding until diarrhea subsides and begin the next new prescription. D, withhold any further feeding until clarifying the prescription with healthcare providers. So the answer here is making sure you understand that diluting the formula can help alleviate the diarrhea. Diarrhea can occur as a complication of enteral tube feedings and can be due to a variety of causes, including hyperosmolar formula. So, again, adding equal amounts of water and feeding to a feeding bag and infusing still at the ordered rate is appropriate for this particular patient. And you do want to monitor eyes and nose, daily weights, and of course, your electrolytes. A female client reports that her hair is becoming coarse and breaking off, that the outer part of her eyebrows have disappeared, and that her eyes are all puffy. Which follow-up question is best for the nurse to ask? A, is there a history of female baldness in your family? B, are you under any unusual stress at home or work? C, do you work with hazardous chemicals? D, have you noticed any changes in your fingernails? So this is a really great question. If you know hypothyroidism, these are classic clinical manifestations that are going to be seen in our patients. So the pattern of reported manifestation is suggestive of hypothyroidism. So a question about the fingernails adds data to the clinical picture because remember, everything becomes very coarse, very dry, very slow, brittle with hypothyroidism. So this is a nice way of really making sure you understand your clinical manifestations, signs, and symptoms of hypothyroidism, which is always a big, big topic to be tested on. Third hospitalization 6 months ago, a client was admitted to the hospital with ascites and malnutrition. The client is drowsy but responding to verbal stimuli and reports recently spitting up blood. What assessment finding warrants immediate intervention by the nurse? Is it A, bruises on arms and legs, B, round and tight abdomen, C, pitting edema in the lower legs, or D, capillary refill of 8 seconds? So the client is bleeding and hypovolemia is likely occurring. So that capillary refill is greater than our normal 2 to 3 seconds, right? And indicates very poor perfusion and requires immediate attention. So, of course, that capillary refill is that abnormal finding that requires my priority, right? So remember, my priority test taking strategy goes back to airway, breathing, and circulation. After the nurse witnesses a preoperative client sign the surgical consent form, the nurse signs the form as a witness. What are the legal implications of the nurse's signature on the client's surgical consent form? Select all that apply. Is it A, the client voluntarily grants permission for the procedure to be done? B, the surgeon has explained to the client why the surgery is necessary. C, the client is competent to sign the consent without impairment of judgment. D, the client understands the risk and benefits associated with the procedure. E, after considering alternatives to surgery, the client elects to have the procedure done. So remember, this is a select all that apply. So our answer choices are and include A, the client voluntarily grants permission for the procedure to be done. C, the client is competent to sign the consent without impairment of judgment. And D, the client understands the risk and benefits associated with the procedure. So the informed consent is required for Any invasive procedure, the nurse's signature, right, as a witness to the client's signature on the surgical consent, indicates that the client voluntarily gives consent for the scheduled procedure. Of course, the client has to be competent to give consent and, of course, understand the risk and benefits of the procedure, always explained by the surgeon. Following a surgery, a male client with antisocial personality disorder frequently requests that a specific nurse be assigned to his care and is belligerent when another nurse is assigned. What action should the charge nurse implement? Is it A, ask the client to explain why he constantly requests the nurse? B, encourage the client to verbalize his feelings about the nurse? C, reassure the client that his request will be met whenever possible? Or D, advise the client that assignments are not based on client request? So those with antisocial personality disorders are manipulative in order to meet their own needs. The charge nurse must set limits on this behavior. The client's superficial charm and emotional maturity prevent effective therapeutic communication. Thus, A and B will be used to the client's advantage. So we cannot have the client request that nurse or encourage the client to verbalize feelings about the nurse. You're going to, of course, reinforce that manipulative behavior. So with C, we're not going to pick that either because this encourages further manipulative behavior. So our best thing to set those boundaries is to advise the client that assignments are not based on client request. A client with cervical cancer is hospitalized for insertion of a sealed internal cervical radiation implant. While providing care, the nurse finds the radiation implant in the bed. What action should the nurse take first? Remember, first priority. Is it call the radiology department? B, reinsert the implant into the vagina? C, apply double gloves to retrieve the implant for disposal? D, place the implant in a lead container using long handled forceps? Solid or sealed radiation sources, such as cesium, which is removed after treatment, are inserted into applicators or cervical implants to admit and, of course, give off continuous low energy radiation for the adjacent tumor tissues. If the radiation source or the applicator becomes dislodged or falls out, long handled forceps should be used to retrieve the radiation implant to prevent injury due to direct handling. This is for the nurse's safety. The applicator is then placed in the lead container. Very important concepts you want to make sure you review, okay, especially implantable radioactive devices and protecting yourself as the nurse. The client with which type of wound is most likely to need immediate intervention by the nurse. Is it laceration, abrasion, contusion, or ulceration? A laceration is an open wound whose edges are often jagged and whose tissues are torn apart. That is produced by the tearing of the soft body tissue. This places the client at risk for bleeding. So this type of wound is likely to require the most immediate nursing intervention. Please make sure you know the differences and the definitions and the signs and symptoms of these common wounds. So again, the laceration wound is often contaminated with bacteria and debris from whatever object caused the cut. So this will require immediate intervention by the nurse. Nurse is planning care for a client admitted with a diagnosis of fetal chromocytoma. Which intervention has the highest priority for inclusion in this client's plan of care? Is it A, record urine output every hour? B, monitor blood pressure frequently? C, evaluate neurological status? Or D, maintain seizure precautions. So priority here, you have to know what a pheochromocytoma is. A pheochromocytoma is a rare catecholamine secreting tumor that may precipitate life-threatening hypertension. The tumor is malignant in 10% of cases, but may be cured completely by complete surgical removal. Although the pheochromocytoma has classically been associated with different types of syndromes, we know that, again, this has been identified as a gene mutation. So the most important thing of a pheochromocytoma is to recognize the hallmark clinical manifestation, which is an extreme elevation in blood pressure. So my priority is to monitor the blood pressure frequently. When caring for a client who has acute respiratory distress syndrome, also known as ARDS, the nurse elevates the head of the bed 30 degrees. What is the reason for this intervention? Is it A, to reduce abdominal pressure on the diaphragm, B, to promote retraction of the intercostal accessory muscle of respiration, C, to promote bronchodilation and effective airway clearance, or D, to decrease pressure on the medullary center, which stimulates breathing? So of course, it's to reduce abdominal pressure on the diaphragm. A semi-sitting position is the best position for matching ventilation and perfusion and for decreasing abdominal pressure on the diaphragm so the client can maximize breathing. This is one classic key nursing intervention you must be very, very confident in and in doing, especially to expand the airway. Because remember, my priority is airway breathing and circulation. When assessing a mildly obese 35-year-old female client, the nurse is unable to locate the gallbladder when palpating below the liver margin at the lateral border of the rectus abdominal muscle. What is the most likely explanation for failure to locate the gallbladder by palpation? Is it A, the client is too obese, B, palpate in the wrong abdominal quadrant, C, the gallbladder is normal, or D, deeper palpitation technique is needed for this patient? So again, a normal healthy gallbladder is non-palpable. It should not be palpable. So again, this is a key part in understanding your assessment findings, your normal versus abnormal, what's non-tender, what's non-palpable, what's non-movable. Know your normals. A woman with an anxiety disorder calls her obstetrician office and tells the nurse of increased anxiety since the normal vaginal delivery of her son 3 weeks ago. Since she is breastfeeding, she stopped taking her anti-anxiety medications, but thinks she may need to start taking them again because of her increased anxiety. Is best for the nurse to provide this woman? Is it A, describe the transmission of drugs to the infant through breast milk? B, encourage her to use stress relieving alternatives, such as deep breathing exercises? C, inform her that some anti anxiety medications are safe to take while breastfeeding? Or D, explain that anxiety is a normal response for the mother of a 3-week-old? There are several anti-anxiety medications that are not contraindicated for breastfeeding mothers. So the mother is apparently aware that drugs can be transmitted through breast milk. So A is not a helpful choice. B might be helpful, but the client's history suggests that non-pharmacological methods of anxiety management do not produce the best outcome for her, especially at this time. D would tell you that the mother's history places her at risk for severe anxiety. So it's best to inform her that some anti-anxiety medications are safe to take while breastfeeding. An older male client with a history of type 1 diabetes has not felt well for the past few days and arrives at the clinic with abdominal cramping and vomiting. He is lethargic, moderately confused, and cannot remember when he took his last dose of insulin or even ate last. What action should the nurse implement first? Is it A, obtain a serum potassium level? B, administer the client's usual dose of insulin? C, assess pupillary response to light? Or D, start an intravenous infusion of normosaline? That is correct. D, start an intravenous infusion of normal saline. The nurse should start an IV infusion of normal saline to replace fluids and electrolytes because the client has been vomiting and it is unclear when he last ate or took insulin. The symptoms of confusion, lethargy, vomiting, and abdominal cramping are all suggestive of hyperglycemia, which also contributes to diuresis and remember, fluid electrolyte imbalance. Very key component of diabetes is to understand the signs and symptoms of hyperglycemia. Don't just focus on hypo. You have to understand the classical findings of what makes diabetes diabetes. Who receive multiple antihypertensive medication experiences syncope due to a drop in blood pressure to 70/40. What is the rationale for the physician's decision to hold the client's scheduled antihypertensive medications? Is it A, increased urinary clearance of the multiple medication has produced diuresis and lowered the blood pressure? Is it B, the antagonistic interactions among the various blood pressure medications has reduced their effectiveness? Is it C, the additive effect of multiple medication has caused the blood pressure to drop too low? Or is it D, the synergistic effect of the multiple medications has resulted in drug toxicity, resulting in hypotension? You guessed it right. When medication with a similar action are administered, you're going to get an additive effect, which occurs and is the sum of the effects of each of those medications. So in this particular case, several medications that all lower blood pressure when administered together drop the client's BP too low. So that's why we really have to know and understand our ACE inhibitors, our ARBs, our alpha blockers, our beta blockers, our calcium channel blockers, our diuretics. All of these can have an additive effect when taken together with the patient. The nurse is caring for several clients in a mental health facility. Which client is at the greatest risk for developing delirium? Is it an adult who cannot sleep due to constant pain? An older client who attempted suicide 1 month ago? C, a young adult who takes antipsychotic medications twice a day? D, a middle-aged woman who uses a tank for supplemental oxygen? So the client who is in constant pain and having difficulty sleeping or resting is always going to be at risk for delirium. Remember, delirium is an acute state of what? Confusion. So again, we look for risk factors. Supplemental oxygen may cause some confusion, but we really need to focus on A. Okay? That's what we focus on. Which intervention should the nurse include in a long-term care plan for a client with chronic obstructive pulmonary disease, COPD? Reduce risk factors for infection. B, administer high flow oxygen during sleep. C, limit fluid intake to reduce secretions. Or D, use diaphragmatic breathing to achieve better exhalation. So my key here are the interventions aimed at reducing the risk of infections should be included in the patient's plan of care for COPD. Remember, what kills people? Complications. So Patients with COPD are at increased risk for what? Respiratory infections. Prevention and early detection of infections is vital and necessary. Which location should the nurse choose as the best for beginning a screening program for hypothyroidism? Is it A, business and professional women's group, B, an African American senior citizen center, C, a daycare center in a Hispanic neighborhood, or D, an after school center for Native American teens? Risk groups, risk groups, risk groups, and risk factors, risk factors, risk factors are always going to be a vital part of your studying, and especially recognizing who's at risk for different diseases. So the population at highest risk here that would benefit for a screening for hypothyroidism. And remember, this usually is generally occurring in populations 35 to 60, and the female population is most commonly affected. So a business and professional women's group is most appropriate. A female client has been taking a higher dose of prednisone, a corticosteroid, for several months. After stopping the medication abruptly, the client reports feeling very tired. Which nursing intervention is most important for the nurse to implement? Is it A, measure vital signs, B, auscultate breath sounds, C, palpate the abdomen, or D, observe the skin for bruising? So the correct answer here is very important to note that any abrupt withdrawal of an exogenous corticosteroid can precipitate adrenal insufficiency and hypoglycemia, hypokalemia, and circulatory collapse can occur. It is most important for the nurse to assess vital signs and check for impending shock. This is a critical component. Male client reports the onset of numbness and tingling in his fingers and around his mouth. Which lab is important for the nurse to review before contacting the healthcare provider? Is it A, capillary glucose, B, urine specific gravity, C, serum calcium, or D, white blood cell count? You guessed it right, that's serum calcium. Remember, a classic finding of hypocalcemia is numbness and tingling of the fingers and around the mouth, along with muscle cramps. That classic Chavestics and Trousseau's need to be assessed. What explanation is best for the nurse to provide a client who asks the purpose of using log rolling technique for turning? Is it A, working together can decrease the risk of back injury? Is it B, the technique is intended to maintain straight spinal alignment? C, using 2 or 3 people increases client safety? Or D, turning instead of pulling reduces the likelihood of skin damage? So my key topic here was what? Log rolling. And it's always important because log rolling is for patients that we think might have a what? C-spine injury. And remember, the part of that C-spine innervates my what? My main muscle of breathing, respiration, my diaphragm. That's why the log rolling technique is intended to maintain straight spinal alignment. Okay, very important. Client receiving chemotherapy has severe neutropenia. Which snack is best for the nurse to recommend the client? Is it A, plain yogurt with sweetened with raw honey? B, peanuts in the shell, roasted or unroasted? C, aged farmer's cheese with celery sticks? Or D, baked apples topped with dried raisins? Anybody hungry? It is D, baked apples topped with dried raisins. A patient with chemotherapy-induced severe neutropenia is at high risk for infection. So we need to place them on neutropenic precautions. A low bacteria diet is required. D is a healthy snack for a client receiving chemotherapy. A, B, and C have a high bacterial count and should be avoided. So I know all of you remember your neutropenic precautions, but you've never had one with food. This is a very important question, and I hope you got it right. So stick around. We have more questions coming up. Make sure you participate and look at all of our test taking strategy series. If you're ever part of our Zoom, please make sure to fill out the feedback form, as we want to make sure that we're producing content that really benefits you and to make you the best nurse that you can possibly be in the future. And of course, pass your exams and ultimately pass those boards. So just wanted to say thank you for taking the time to joining us today, whatever time of day it is. Thank you. Like, comment, and subscribe. And remember, everyday nursing is part of what we do.